The Trump administration is pushing ahead with one measure that it says could lower the price of prescription drugs. The White House is issuing a proposed rule that would allow some medications to be imported from Canada. Bertha Coombs has the details.
The Trump administration is setting the stage for states like Florida to re-import lower-priced drugs legally from Canada. Governor Ron DeSantis helped convince President Trump to back the idea.
I've always said, there's no silver bullet with this, but this is a step that no one's been willing to take for almost 20 years. All the way back to 2003, you've had presidents of both parties, you've had secretaries of both parties, and yet until now we haven't done it.
Health and Human Services Secretary Alex Azar had been among those who'd argued against the safety and value of re-importing drugs for years, but says now the drug price environment is different.
There have always been questions about how effective it can be at lowering costs. Over time, the drug pricing marketplace has changed, and we've seen improvements to supply chain safety as well.
Under the administration's proposal, states working with wholesalers would apply to the FDA for approval to import certain brand name drugs from Canada, mostly in pill form. Low-cost generics and high-priced injectable drugs like insulin would not be included under the measure. The move would not create much of a dent for high-priced drugs to find their way back to the U.S.
It would be quicker to put drugs on a dog sled from Canada and point it toward Florida than it would be to get a drug through this new regulatory process.
It will take several months for a final rule to be implemented before the first states could apply for approval. And it's not clear the Canadian government will facilitate exports of drugs they've negotiated for.
We hope they'll work with us. I think they're obviously concerned about their own system.
What's more, analysts say drug makers would not be incentivized to produce more drugs to re-import at lower prices.
Manufacturers can control how much volume goes into Canada, so they're unlikely to dramatically increase the amount of drugs in Canada just to have them get shipped into the U.S. at lower costs than the cost of drugs in the U.S.
The administration admits it has no benchmark for just how much reimportation of drugs could save Americans, but say the president is committed to try. For Nightly Business Report, I'm Bertha Coombs.